Next, Justin Booth, Executive Director of GObike Buffalo. Go
Thank you for
right
having
ahead.
me. Thank you for holding this hearing on
Sure.
Complete Streets. Yes, I'm Justin Booth, Executive Director at GObike Buffalo. I also chair the City of Buffalo Common Council's Bicycle and Pedestrian Advisory Board, which reviews all city thoroughfare plan projects, and also a member of this New York State Safe Streets Coalition. I've also had an opportunity to work with over 100 towns and villages across New York State on Complete Streets. So I bring a perspective of not just from working in the city of Buffalo, but also suburban and rural areas as well. So we know as Complete Streets are designed and meant to be operated to enable safe access for all roadway users, including pedestrians, bicyclists, transit riders, and motorists regardless of age or ability. Yet when 72% of all trips in the United States are less than a mile are driven, there are negative consequences for people in our communities. 1 in 3 children in New York State are considered overweight and obese, largely due to a lack of safe places to walk or bike, which significantly limits opportunities for activity. According to a 2011 New York State Comptroller report, this is costing the state $327 million annually in direct and indirect medical costs. And for adults, this jumps to $11.8 billion annually. When a 1-mile walk takes approximately 15 minutes, and the Surgeon General recommends a minimum of 30 minutes a day to maintain health, designing safe, complete streets is a simple way for people to be healthier as part of their daily routines, like walking to the school or to the market. In fact, the New York State Department of Health's Creating Healthy Schools and Communities program specifically funds organizations around New York State to work with communities on developing complete streets policies and projects because it is an evidence-based mechanism to improve community health. Complete streets are also an equity issue for low-income households. According to AAA, as we heard earlier, the average cost of car ownership is upwards of $10,000 annually in 2022, which is a continued increase from 2019 when we saw that number just over $9,000, and that number continues to rise. With the median household income in Buffalo, New York at just over $39,000 a year and 28% of the population living in poverty, the cost of owning and operating a vehicle is a barrier to access basic needs, jobs, and future opportunities. In New York State, the DEC has identified the transportation sector represents 28% of all greenhouse gas emissions that are contributing to global climate change. This could easily be reduced through complete streets by simply converting the 72% of all trips under a mile made in a vehicle into a walking or cycling trip instead. Between 2017 and 2021, the New York State Department of Transportation recorded 121,807 automobile-involved crashes, or an average of 67 crashes per day in Erie and Niagara counties, with 64 people dying each year. Despite being involved in a far smaller proportion of total crashes, only 3%, 1 in 4 fatal crashes resulted in the death of a person walking and cycling. The New York State Department of Health recognizes traffic deaths and injuries as a major preventable public health problem. In fact, crashes are the leading cause of injury-related death, second leading cause of injury-related hospitalizations, and third leading cause of injury-related emergency department visits in New York State. The resulting care needed presents a significant public cost, with the combined hospitalization and emergency department charges averaging $1.1 billion annually. Implementing complete streets is essential to making our roadways safe. While some may think that a key attribute are sidewalks and bicycle lanes, it is actually the slow vehicle speeds, because we know that if a pedestrian is struck by a vehicle traveling at 40 miles per hour, they have a 15% chance of survival, while at 20 miles per hour, their survival rate goes to 95%. A model case study in Erie County, New York, is the village of Hamburg, just south of the city of Buffalo. With a population of just under 10,000 people, it had a decline following the collapse of the steel industry and opening up of a nearby retail mall. In 2001, the DOT proposed improvements on Route 62, a state roadway, which would add a vehicle travel lane and shorten sidewalks along the village's 1-mile-long Main Street. Concerned locals formed a citizens group and developed a design alternative, which was implemented in 2009, that narrowed existing travel lanes from 12 feet to 10 feet to reduce speeds, enabled them to add street trees, on-street parking, and bike lanes. Signalized intersections were removed in favor of roundabouts. Mid-block crosswalks are added along with curb extensions at intersections. Between completion in 2009 and 2013, vehicle crashes on the street fell 66% and injuries fell 60%. Since this public investment in complete streets was made, business owners, inspired by the new road, spent a total of $7 million on 33 building projects in the 4 years after construction. The number of building permits rose from 15 in 2005 to 96 in 2010, and the property values along Route 62 more than doubled in the same time period. The Village of Hamburg should not be the exception to the rule, but the model for all projects to follow in our villages and towns across New York State. As chair of the City of Buffalo Common Council's Bicycle and Pedestrian Advisory Board, I've had the opportunity to review and provide recommendations on all thoroughfare plans developed by the City of Buffalo. Since being the first city in New York State to adopt a complete streets policy in 2008, implementation has relied on maintenance projects. When a street is being repaved, the City of Buffalo has recognized the most cost-effective opportunity by simply adding some additional paint to slow vehicle speeds, improve pedestrian access, and add bicycle facilities. Recent data in Governing Magazine coming out of New York City DOT has shown simple changes such as road diets, bicycle lanes, curb extensions, turn calming can reduce the number of people killed or seriously injured on our streets from 15 to 30%. While the unprecedented COVID pandemic upended many aspects of daily life, including how people get around, one terrible long-term trend was unchanged: the alarming increase in people being struck and killed while walking, which is at a 40-year high, disproportionately impacting older adults and those living in low-income communities of color. According to the American Society of Civil Engineers Code of Ethics, engineers first and foremost must protect the health, safety, and welfare of the public. If this is the case, the traffic engineering profession is failing us. It is essential that complete streets are applied to all projects, that additional funding is provided to local municipalities, and they are implemented in a context-sensitive manner to equitably improve the safety, health, and economic vitality of our communities. It is no longer appropriate nor morally acceptable to solely focus on vehicle efficiency on our roadways when we have the tools and cost-effective measures to improve the quality of life for all people, regardless of age or ability in New York State. Thank you.
Thank you very much, sir.